Elizabeth Callahan balances being a mother to a child with autism and a teacher to children with a range of abilities. She has witnessed firsthand the lack of mental health services and resources for children. Callahan says she had a range of in-person resources for her son before COVID-19, such as applied behavioral analysis therapy. The online modality after COVID, however, was not a good fit for her son.
A lot of his therapy then started online, and my child could not sit on a computer online doing his therapy. And his ABA therapist, she said she would make more being unemployed, so she left the job. So it just left us high and dry in the middle of COVID, and we didn't have therapy for him.
Since then, she says it's difficult to get any type of mental health services for her son, and it's something she also sees with her students.
You literally cannot get an appointment for months.
According to the American Academy of Child and Adolescent Psychiatry, Virginia is in a severe shortage when it comes to finding practicing child and adolescent psychiatrists. As of 2019, there are only 264 practicing child and adolescent psychiatrists, with nearly 2 million children in need of services. That is 14 psychiatrists for every 100,000 children. The Virginia Department of Behavioral Health and Development Services has put a total of $7.5 million into the mental health pilot program. The program is meant to help integrate mental health services into schools. But according to Voices for Virginia's Children policy analyst Emily Moore, there are not enough staff to help the children.
We have money in the budget for a school-based mental health integration pilot, and we don't have enough school psychologists, we don't have enough licensed professional counselors, we don't have enough licensed clinical social workers to go into every single one of our schools and provide that support to young people.
Hiring and training takes money. Richmond Behavioral Health Authority CEO John Lindstrom says the first step to tackling the ongoing crisis is by gaining more funding towards new hires.
One, we're looking for funding that might incentivize individuals to come into the field, so to speak. Ideally, we should not be running the vacancy rates that we run if we want to offer a robust set of services to anybody that needs them. And that is really our goal.
Next, Lindstrom says mental health specialists need to be able to provide care quicker.
So our goal really is same-day access for anybody that has a behavioral health or developmental service need.
As of 2019, all but roughly 6 states have a severe shortage in child and adolescent psychiatrists. Initiatives such as the Virginia Mental Health Access Program are fighting for better mental health resources for children. Virginia Mental Health Access Program lead and VCU Health child psychiatrist Dr. Bella Sud says one of the program's goals is increasing the number of child psychiatrists through proper training and education.
So the VMAP program is essentially the training and teaching of pediatricians in how to manage mental health issues in their own offices, with the assistance of specialists who are child psychiatrists who work with them on consults that they might ask for. We also teach pediatricians through formal courses like the REACH course, which is a nationally certified course. It is a 3-day turbo fellowship in child mental health.
Callahan says if there is one thing she would say to those who could make a difference in the crisis, take a walk in her shoes.
It's more meaningful to me ever since I've had a child with autism. Like, I am now like a huge advocate for not only my child, but all the kids in my school. Like, when I see something that's not right, like, I'm going to these meetings and I'm speaking up and I'm saying, like, what's happening? Like, what are we doing as a school? How are we not supporting this child or whatever? So I think I would say is, like, you need to put yourself in my shoes of where I'm coming from, because I eat, sleep, and breathe this every day.
Reporting from Richmond for VCU InSight in the newsroom at VCU, I'm Daemon Hollinshed.